Hey y'all, it's your girl, She Nurses TV. It's nursing, it's what I do. Welcome to my day shift, night shift, split shift, swing shift. All my coworkers out there getting it in, making the bag. Stay safe during the C-19 pandemic, and God bless you always. So, y'all, as I was sitting here thinking, I'm like, I know it's some nurse inventors out there. I just know it is. I can feel it because we're always thinking of easier ways to do things, when we're taking care of our patients. And I found some interesting things, y'all. Very interesting. Okay, the first one, as you can see, is the pad. The sanitary pad, sanitary napkins, maxi pad, Kotex pads, whatever you want to call it, was invented by a nurse. It all started in World War I when they used this like it's called cellulose material to bandage up the soldiers, and it was like extra absorbent, more absorbent than cotton. This article says, and the nurses used it, on the soldiers, and they found out it was quite useful to use it, secretly when it was that time of the month. So this product was commercialized. It says once the war was over, and they started creating the Kotex, putting it inside of the Kotex with some help of some people that could help the idea come along. That is so interesting. A man invented the tampon. He said just stick a cork in it, and the woman came along and invented the pad. Very, very interesting. Let's see what next is on here. Oh my goodness, y'all, the crash cart. The crash cart was invented by a nurse. Before the crash cart was invented, when a patient's life was on the line, they used to just, send a runner down the hallway. We need this and we need that. We need that. Like, and the patient's life is literally hanging on the line, and you're running around here trying to grab all these tools and materials you need to save their life. So those valuable minutes and seconds could really determine whether that patient lives or dies. It really can. So a nurse invented the crash carts. Let's see if it has her name in here. Her name was Anita Dorr. Anita Dorr, Dorr. She came up with the idea to create the crash cart. They called it the crisis cart in the beginning. She made it in her basement, and it was co-founded by the Emergency Nurses Association. It was basically a cart, and she put different drawers in there. I'm pretty sure she maybe started out with 3 or 4 drawers in the cart. And it had different things that were medically necessary when it comes to a life or death situation. How awesome is that? Now, this one right here is very, very, very important, as well as the other two. I'm just saying. I did not know this, and I'm a nurse, y'all. Mind you, I'm a registered nurse, and I didn't even know these things until I did my own research. They have color-coded IV lines that were invented. Let's see, who invented this? Barton Salinas. Barton Salinas had the idea of color-coding the IV lines. When it came to her applying lines to assist with the delivery of a newborn, she worked in labor and delivery, apparently. Her full name is Terry Barton Salina. Terry Barton Salina and Gail Barton Hay, her sister, they both patented the lines in 2003. Now, this was a way for them not to get medications mixed up. How genius is that? It provides patient safety. You're not delivering the wrong drug to the wrong line. It's color coded, so the same label that's on the IV bag will be the same color of that tubing running to that patient, so you'll know exactly what each one is, and that'll help you to quickly identify the medications as well. You're like, okay, I marked the normal saline bag. I put that on the yellow tube. I got that marked with a yellow sticker. Okay, the other fluid is purple. I got a purple line coming from there. This is just genius, y'all. Because normally, if you go into an IC room or a regular hospital room and they've got 3 or 4 IVs hanging up there, they're all clear. And you don't know what's what. And it's only just a little small sticker that is telling you what the medication is. I mean, it's easy to label something wrong, especially if you're mixing more than one medication up, to save yourself some time. It's easy to get that crossed up. So I love the idea of the colored coded IV lines, and I've never seen that before, and I've been in nursing for 8 years now, so I would love to see that more in the hospitals. I'm pretty sure maybe it's more pricey. I'm pretty sure it is, but I mean, patient safety is everything. All right, now, let's see. Now we go into number 4, which is the neonatal phototherapy. Neonatal, that's a newborn. You get jaundice. Some of the babies are born into the world with jaundice. It's the yellowish coloration that they get to their skin. It's when they have high bilirubin levels in their blood, and it makes their skin look yellow. And the high levels are caused by the destruction of red blood cells. If the liver is not functioning properly, the bilirubin obtained from red blood cells will not be broken down, which is highly likely in newborns, this article says. So today, they are assisted with sunlight, but this solution was founded by mistake. This nurse's name is Sister Jean Ward. In 1950, she observed that when she took the infants out, during the day to get some sunlight. She was a nurse at Rockford General Hospital in Essex, England, and she would take the newborns out to get a little bit of sunlight. And one of the doctors noticed that the part of the baby's body, one part was more yellow than the other, and the doctor noticed that the part that was less yellow was the part that was exposed to the sunlight. So now they practice the phototherapy in newborns. Isn't that awesome? Wow, that's where that blue light comes in at. They're treated with the blue light, and they have this little what do you call it? Looks like the little eye mask you put over your face at night. Now, because the newborn is so sensitive to sunlight, here it goes again. The Billy bonnet was created. So they would cover their eyes with the Billy bonnet. Now, this Billy bonnet was discovered or invented by Sharon Rogone, Rogone. She was working in the neonatal ICU of a hospital in San Bernardino, California in the 1990s. And she made, glasses to cover the baby's eyes. In the beginning, they pretty much used whatever material they had available. But then they founded the Billy bonnets, which is just a soft protective covering that will go over the newborn's eyes. And she started the company that she started invented that. And it took off ever since. Here we go. Number 6, baby bottles with disposable liners. Wow, now who would have thought a nurse invented that? I don't know. I wouldn't think of anything like that. I guess, I'm not in labor and delivery. I'm on the rehab side of nursing, medical surgical side. So I don't know. I guess if I'm not working in that specialty, I might not have thought of it. But in 1940, Ada Mae Allen, a nurse in Columbia Hospital, Washington, discovered that babies exhausted themselves when nursing with bottles. So they were getting tired pretty easily. Can you imagine how tired a newborn baby would be sucking from a regular bottle? And this supposedly makes it easier. So she made Miss Ada May made a disposable liner which created a partial vacuum as the infant nursed on the original bottle. Wow, okay. Huh. This will result in invert of the nipple. So the sides will come closer to each other in the plastic liner while the infant drank the milk. Genius. 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 Love it, love it, love it. Number 7. Now this is a feeding tube that was originally created for paralyzed veterans. This nurse's name is Bessie Blount Griffin. In the time of World War II, she created a tube that would help feed the paralyzed veterans who were unable to feed themselves by using their teeth. This restored their independence when food in liquid form could be chewed down the tube. Bessie was named Wonder Woman and this wasn't the only invention she was responsible for. She became the first African American woman to be employed by Scotland Yard. Wow, she created the feeding tube. And you know there's so many different feeding tubes. You got the ones that go through your nose, you got the ones that go through your stomach. There's so many different feeding tubes out there now. Wow, good job. And we use those so much. So much. All right, the next one is the ostomy bag. And you'll see the feeding tube right here. It's a little tube that's on like the left side of her stomach. And the next one is the ostomy bag. And you'll see the ostomy bag right here on the right side of her stomach. That's where, if you can't, it could be permanent. It could be temporary. If you're not able to use the bathroom normally by yourself, you would be assisted with an ostomy bag, temporarily or permanently until you heal, or just to help you to have a form to be able to release your waste. Now, the ostomy bag, it says Thora suffered from colon cancer and used an ostomy equipment for her waist post-surgery. The odor and often leakage led Ilis Sorensen, Thora's elder sister, and a Danish nurse visiting to invent a plastic pouch that could remain close to Thora's body. Ever since 1954, the patients who go through ostomy surgery use the ostomy bag. That is just awesome. That is awesome. I never knew a nurse invented that, y'all. This is some awesome stuff, y'all. I love it, love it, love it. So these are 8 medical inventions that were made by nurses. I got this off of the wonderful engineering website, wonderfulengineering.com. I'm going to shout out. I love this. If you are a nurse and you invented something that may not be as popular, look, let us know. Let me know, and I'll be glad to highlight it. This is awesome. So just to let y'all know, nurses are out here inventing stuff, and I could imagine what they're inventing these days. But yeah, I just wanted to let my coworkers know that. Y'all have a great day, and I'll see y'all next time. Bye.